How much do you know about your ancestry and what diseases you may be genetically predisposed to? Well, 23andMe is a company founded by Wojcicki that aims to empower consumers with information about their own DNA. In the process, one of the world's largest databases of individual genetic information has been constructed. Backers include NEA, Johnson & Johnson, Roche Venture Fund, and Google Ventures. We should mention that Anne is married to Google co-founder Sergey Brin. She sat down with our Cory yesterday at the Web 2.0 Summit.
So the whole idea is that people reference their DNA all the time, and our goal is to enable you to look into yourself, look at 1 million data points in your DNA, look at the ancestry, look at the health, see the billions of dollars of research that's going on genetics, and see how that all applies to you.
I think one of the biggest takeaways when I look at your company is that drugs don't work on everyone.
Right.
But they're sometimes assigned and prescribed to everyone.
Right, and that's exactly one of the things that we hope will change, that if you are given an antibiotic, you're sick, you have pneumonia, is it going to work for you? So everyone has genetic variability in why some drugs work for them, some drugs don't. We all hear that story of things even as simple as Benadryl. Some kids get hyper, some kids get sleepy. So we want to understand why some drugs are working for people, some drugs don't, why some people have adverse events, why other people don't. And that's, I think, going to be one of the most powerful aspects of genetics.
Well, and off camera, you and I were just ripping on Wall Street. Wall Street is not inclined to help this problem, right? They want everyone to get the drugs. The doctors think it's just cheaper to try stuff rather than have the patient know what's going to work in advance.
I think one of the fundamental problems in healthcare is that the consumer doesn't have a real voice, and that what benefits the drug companies, what benefits academics, doesn't necessarily benefit you. So I always ask the question, who makes money when I do not develop type 2 diabetes? Because there's lots and lots of people who make money when I do develop type 2 diabetes.
Right, have another donut.
Right, exactly. There's lots of ways you can monetize that. But if I don't develop it, who's going to make money? And I think that's one of the fundamental things that we need to shift in healthcare. And it's one of the core tenets of 23andMe is we're all about prevention. We want to usher in an era when we're just preventing disease rather than trying to effectively treat it.
Well, and this story about your husband is known to some of our viewers. He started this search engine thing.
It's small.
It's a small search engine. It's getting big. And you were kind of surprised what you found out when you got his genomic.
We were very surprised, and we were actually advised by a lot of people not to get tested. And I was very insistent that I wanted to test my husband and see, does he have the genetic variant that makes him at high risk for Parkinson's disease, because he had a family history of Parkinson's, and he does in fact have it. So what's empowering to me is that we now can try to do something.
But what good is that information? What can you do?
So one of it is we're a lot more vigilant now about exercise, diet. We follow the research very closely. So we're very close with the Michael J. Fox Foundation. There's data coming out about simple things like caffeine consumption, and drinking more and more coffee looks like it lowers your risk for Parkinson's disease. So he started to do that. But for us, just having that power and saying, I'm doing something. And one of the things we want to get people excited about is that you might know that you're at risk for something in the future, so you should do something now. The only way we're going to get a cure, or the only way we're going to get an effective treatment, is if we're not afraid and we do something about it today.
Well, I think what's really interesting also, you were just talking at the Web 2.0 conference about this, about you take a pool of data from people that you know are at risk or have a disease, but you match that with a giant pool of people who don't, so you can find out people who might have been at risk but did something different.
Right, and so that's actually what we announced today, is that we've been able to actually look at our Parkinson's cohort. We have 6,000 people with Parkinson's disease.
Cohort, for those not in the health field, is just a group of people with a like-minded condition.
Right, so we announced today that we have a group of 6,000 individuals with Parkinson's disease. We've been able to look at those 6,000 people, and we look at the other 120,000 people who do not have Parkinson's disease in our database, and we were able to find something that looks like a gene that is preventing people from developing Parkinson's disease.
It's amazing.
So, and we announced that we have a collaboration now with Scripps, where we're actually looking at that to see, is it a potential druggable target? Could this be a drug one day? We're really, really excited about it, that it's the first time really that consumers have all come together, and that the result of consumers and patients coming in, filling out surveys, getting genotyped, that they actually have generated research that could potentially lead to a drug.